We had 2 days in a room with about 30 people, really exploring in depth some of the kind of key themes that people wanted to talk about, whether that be self-stigma, working with children and young people, working in communities with champions, a whole range of different things. So we've had mainly European, a couple from the States and from Canada, and then from New Zealand. Our Australian colleagues couldn't make it this time, which is really unfortunate. And then, of course, in Britain. So Time to Change England, Time to Change Wales, and ourselves.
We're all in this together. Employers, communities, friends, media and others, and the Scottish Government, of course, to end the stigma of mental ill health. Mental health is a global issue, and the presence of so many global partners in Glasgow this week is testament to that.
Having the Global Alliance really helps because we get to connect with others and see how they're facing their challenges. What are their successes? What are their learnings? And to share our approaches as a way of developing kind of a learning community so that we can kind of lift all boats.
Sharing information and best practices, I think it's good. It's like a synergy. It makes improve all of us more than if we were by ourselves. All together, we are more than what we are.
And then the thing of having different programs, each of them are based in different. For example, some of the programs are more community oriented. Some programs are more service oriented. Some programs are more, relate to community, engagement.
For me, I think there's a focus on workplace. I think just the globalisation of the messages, I think, is a key thing for me. I've enjoyed the conversations around internalised stigma and got some ideas about how we could go further with that.
I think working with what you call champions, I think that's the basic. If we don't get people who have been through mental illness or still are having mental illness and they don't work with us, it's no good. But it's not working with us. We have to work with them. So it's changing it around. And that's every program has the same, and they tell the same, and there is evidence that that's the best. But I don't think it's only evidence. It feels very good.
Through the process of being involved with CME, I've been given lots of opportunities to do things that I initially would have been extremely hesitant about, such as public speaking, working in groups, facilitating group discussions, conducting research, things that I was able to practice in a safe space that are now a part of my professional life. At the age of 28, I've got my first salaried job, and that might seem like a slow start to a career, but I could have been dead at 20. In my estimation, I've probably got more out of being involved so far than I've put in. So will this help to achieve the overarching aim of reducing stigma and discrimination against those with mental health issues? I'm not sure, but without risk of failure, what can ever really be learned?
If we're not all talking about it like it's everybody's business, then we're not going to change a culture that allows young people to build confidence, resilience and all of those things. And we all, it doesn't matter what you do and it doesn't matter what expertise you have, we all play a part in enabling children and young people to live, to grow up, to feel resilient and positive and to have a good outcome.
I do still have depression and anxiety and I'm still living with it on a daily basis. But actually being able to volunteer and give my opinion on what I think would be beneficial for someone that would be just starting to experience a mental health problem would be so that's been a really positive thing to be able to do.
Stigma and discrimination of mental health issues have been around for thousands of years. Change comes slowly, and if we work together and compound our efforts, we can really potentially create great change.